Chairman and Editor-in-Chief of the Network 7 Media Group. Known for championing the cause of citizens' rights and free speech, Dr. Satya has been at the forefront of United Nations peace programs. Dr. Satya is also the author of Vision India, Truth versus Hype. He is an industry expert and one of India's top journalists. Dr. Satya holds a master's degree in political science with first gold medalist from the Berhampur University and a master's degree in journalism and mass communications and a doctorate in mass communications. So ladies and gentlemen, please welcome Dr. Satya Brahma to deliver the welcome address. And wait, before he comes to the stage, we will also be running an AV of Dr. Satya's perspective on the present state of healthcare reforms in the country. So, before the welcome address, can we have the AV, please?
Today, we stand at crossroads in the history of our nation. A moment that demands action, courage, and above all, a commitment to transform our healthcare system. Let there be no confusion. Healthcare is not a luxury. It is a fundamental right. Every citizen of this country deserves access to quality medical care, regardless of their socio-economic status. Healthcare for all. Building a stronger, healthier India from vision to reality is the need of the hour, says the visionary founder and chairman of Network 7 Media Group. Globally, India is the largest provider of generic medications, often referred to as the pharmacy of the world. The country provides more than half of the world's vaccines and 1/5 of production volume for medications. And with the help of the following India-based companies, the country sets out to grow its pharmaceutical sector to $130 billion by 2030. Dr. Satya Brahma, the brain behind the formation of Pharma leaders, the global healthcare media from Network 7 Media Group, outlines the missing dots of the healthcare industry. In India, where only 34% of the population has access to essential healthcare within a 5-kilometer radius, the need for a comprehensive financial strategy is even more pressing than ever. With nearly 2/3 of health spending driven by out-of-pocket expenses, the financial strain on individuals pushes over 55 million people into poverty every year. The roadmap for 2024 underscores a critical imperative for a comprehensive financial strategy to revolutionize healthcare accessibility across India. As we navigate this intersection of unprecedented healthcare advancements and societal responsibility, it is clear that precise financial management priorities are the linchpin for achieving affordable and equitable healthcare at grassroots levels. The call to action echoes the diversification of investments in infrastructure, R&D, and capacity building to realize India's vision of universal health coverage by 2030. To propel India into a global healthcare innovation hub, the most strategic investments should be towards steering a transformative journey in patient care through cutting-edge R&D efforts. Recent health technology investments, exemplified by the reimbursement of drugs, are crucial for this paradigm shift. The policy makers and governments, both at the center and state, must awaken to the stark reality. India's healthcare spending by the government is abysmally low. This is not just a statistic. It is a glaring gap that undermines the health and dignity of our people. We cannot afford to hide behind slogans or delay critical decisions. What India needs now is bold reform, not rhetoric. We must prioritize healthcare investments, expand access, and ensure no citizen is left behind in their time of need. The time to act is now. Press the reform button, lead with courage, and deliver on the promise of a healthier, stronger India. Jai Hind.
Now I request Dr. Satya Brahma to please deliver the welcome address.
We are hosting this event at a time when the healthcare industry in particular is going through a sea of changes. It took me a couple of time to understand that how we have changed in due course of time actually. India is the destination of the world when it comes to healthcare actually. India is the largest manufacturer and the largest generic provider to the US. You look at the manufacturing plants of India, there are so many US FDA, UK MHRA compliance in India actually. We have been excellent in providing healthcare services in India. But to me, the problem lies with the government of India. The healthcare spending in India is around 3 to 4%. If you look at the global range, the European countries, it's much more than that actually. We are sitting on this hotel and we're discussing about the healthcare landscape, the modern healthcare, how it is going to save the future. But do we understand that the real stakeholders of the country live in villages? These are the rural India which will determine how India is going to look forward. We have been seeing in the parliament what is happening actually. Somebody has gone up on the floor and raising the slogans. There is a debate going on for the one nation and the one poll. There are fights, there are infightings going on in the parliament, but we never discuss about the crucial aspects of this sensitive industry, about the healthcare industry. Why do the Prime Minister of India will have to tell them that you take Jonosad or you take the generic medicines to the outlet? Do we know the efficacy of these products? I have personally identified, and my journalists who have been on the ground, they have gone to these outlets and they are purchasing actually. For example, pantoprazole. Pantoprazole is a drug actually which is used in an acute situation. But if you go and buy from any government outlets, you'll get it around 7 to 10 rupees. But what about those companies like Cipla, Glaxo, Johnson, like Jadis Cadila, like so many other companies who have invested actually crores of money in research and development? After so much of promotion, after so much of educating, they are bringing out this product and giving it to them. Are you trying to tell the doctors that please prescribe the Jonosad product or you prescribe these generic products and don't look at these products? To me, this is very wrong actually. What you should look at, please tighten the noose of these people. You make healthcare accessible. You make healthcare affordable. But at the same time, you please think the quality of the medicine should be of paramount importance. I had the occasion to meet Dr. Krishna Illa of Bharat Biotech. He has been to many programs actually. I asked him, how can you bring Covaxin in a period of 1 year? He's telling it is practically impossible, I cannot do it. Then I told, why did you do it? Then he told, I had to do it because I got a pressure from the government. It is true that Covaxin can help you as an immune booster, but it is not the solution actually. As of now, when I speak, 1,48,247 cases filed against AstraZeneca's medicines against Covaxin actually. After taking the medicines, the patients have started complaining about the liver, started complaining about the heart disease. The father of Indian diabetes, Professor Mohan, Dr. Mohan is sitting here, he will answer you. People are still feeling the complications actually. To bring one polio vaccine, it takes around 15 years of time. India has not even produced a single molecule actually. In the year 1999, when I was 25-year-old, I had the courage to start the first program actually. I called late Dr. Anji Reddy. I called Lupin Chairman D.B. Gupta ji. I called Samprada Singh ji. I called these people actually. And they were trying to bring out a molecule which could actually give them a future. It has still not become a reality actually. None of the doctors in India will go to the rural villages actually. I can tell you with a sense of responsibility, the public healthcare mechanism in the country has collapsed. You cannot go to a government hospitals now. Why you cannot go to the government hospital? Because if you go to the government hospital, the doctors will not give you importance actually. Why they will not give importance? Because they are not sufficiently paid. You have the money to spend thousands of crores for the elections. You do not have the money to give the remuneration to the doctors who are saving the lives of the people. Is it the kind of policy that you want to bring into the nation? You tell in public that the doctors are the saviors of the country. You come on national television. I'm not blaming any prime minister. I'm not blaming any policy makers. My simple point is very clear. Please look after the doctors very well. My heart actually bleeds. My heart actually pains when I see the incidents of in West Bengal when the doctors are attacked actually. But equally it bleeds me when the fighting happens between Trinamool Congress and the government of India over the who are responsible. You were the Prime Minister of the country and she's the Chief Minister of the country. Mamata Banerjee also should not make a discriminatory note. They should do what is best for the people. What is the best for the well-being of the people actually. You cannot separate healthcare from the mainstream. You must realize that healthcare is the single most important factor in the country which will actually benefit all of you actually. We do not have universal healthcare insurance in India. And we are talking about Ayushman Bharat. Ayushman Bharat, if you go there, it is not directly benefiting them because the money doesn't reach out to them. You go to Brisk Candy, you go to Apollo, you go to any hospital. These hospitals will not take you actually. And they're right. How much they're spending money on infrastructure? And I can guarantee you, give you in a blank paper actually. You go to this private hospital, give to Dr. Bhimon's clinic, you will come out clean. You come out with a total disease-free actually. But if you go to the government hospital, it will not happen. Why it cannot happen? We can bring a resolution from the Jammu and Kashmir. We can build a temple. That's good. It's very good. It's good for us. I'm a proud Hindu. But let us build world-class hospitals. Give them treatment. Put a procession order. Bring the doctors in the mainstream. Call the doctors periodically to the PMO's office. You don't call them. You don't meet OPPI members, you don't make ADMA members, you don't make Indian Pharmaceutical Association members, you don't make Chemexil members, you don't make Pharmexil members. Why you want to do on your own? Why you want to take the law into yourself? Call them, discuss with the meeting. Don't create a panic-like situation where the patients are suffering. I've been to many villages actually. I've covered so many villages in my time. My entire life has gone by meeting villages only. When I go and meet them, actually, there are actually quacks. You ask for any simple paracetamol, they will give you ciprofloxacin. And they will tell you it will cover both antibiotics and also it will cover you anti-analgesic actually. This is not the fact. You are not the doctor. And you do not have sufficient doctors out of 1,000 patients in India. There is one doctor. The data may be different. What I'm talking is the official figure. This is disappointing. This is distressing. For India to move forward, for India to be a global power, for India to be one of the best nations in the world, for India to capture the attention of the destination hub of the foreign direct investment, for India to become the leading power of the world, for India to be the third largest economy, for India to be the most preferred destination, what you need to do, you need to bring out a system, you need to bring out a policy, you need to bring reforms, and you need to make systems very much accessible. Should not control so much of bureaucracy. The bureaucracy hassles in India are killing actually. And to my mind, this is very dangerous. So let's unite together, make a better India, make India safe, and make healthcare accessible and affordable. Thank you very much, and we'll have the latest presentations coming out. Thank you all.
Thank you so much, Dr. Satya, for your concerns that what you have reflected. And many things needs to be done as far as healthcare is concerned. And of course, we have many good people